Okay, next we'll talk about cerebral palsy. Cerebral palsy is associated with hypoxemic injury, brain injury, and that may occur prenatally, intrapartum, or postnatally. So at one time, there was this assumption that cerebral palsy was always due to some mismanagement of the birthing process, and it always occurred intranatally. But it actually is much more likely to be due to something that happened either prenatally or in the immediate postnatal period. So it's more common in kids who are premature, low birth weight, who experience some birth asphyxia, who had infections around the time of birth, who had some kind of trauma, who have cerebral hypoplasia, which is the brain does not grow adequately, or who experience hypoglycemia or kernicterus. So basically, this is brain damage. There is some neurologic injury and it causes disability. Cerebral palsy is not progressive. The damage does not get worse. There are different classifications, but those really have a lot to do with what the symptoms are. So the symptoms might be spasticity. The patient has too much muscle tone and they have muscle spasms. Okay. They might have involuntary movements or dyskinesia and difficulty with speech articulation. The muscles in there, the muscles required for speaking don't work properly. They might have problems with coordination and ataxia. This is diagnosed usually based on when early, we look at early diagnosis, early identification of some kind of dysfunction, some kind of they're missing milestones. So some of the things we might see are motor delays. They're not hitting motor milestones. An early hand preference, because babies typically don't have a hand preference that develops later. So if they develop a preference for one hand in infancy, it may be that the other hand is not working properly for them. They may have poor sucking and feeding difficulties. When they begin walking, they may be toe walking. They may have increased or decreased muscle tone. They may scissor their legs, and that's a common manifestation. They may have reflexes that should be going away because they're infant reflexes that are not going away. Cognitive ability may be significantly impaired to normal to above average. So there's a massive range of cognitive ability. They may have seizures. They may have sensory impairments like vision, hearing. They may, I was looking at diagnosis. Usually this diagnosis is not confirmed until about 2 years old. They may do MRI. If they don't find a structural abnormality, they may get some metabolic and genetic testing to rule out other causes. So management, there are several goals of care. We want to help that child develop the ability to move, to communicate, and to care for themselves as much as possible. So they may have orthotics to help give stability to a weaker limb. They may have a wheelchair, a cart, or a customized stroller. They may have a walker or some supported ambulation device. They will be getting physical therapy if they have motor deficits. Any structural problem that interferes with mobility may be surgically corrected. They're going to get speech therapy to try to help them be able to communicate. They may also get communication devices. And if they have motor issues that affect speech, they're also likely to have motor issues that affect swallowing, so they may need assisted feeding. And then occupational therapy helps develop life skills or the ability to perform ADLs and IADLs. We want to optimize their motor function with physical therapy. We want to correct any problems that are caused by the cerebral palsy. So it's common to have spasticity cause contractures and skeletal deformities. And so they may get meds, muscle relaxers, to help reduce those spasms, or they may even have surgery to relieve some of those spasms. Botox reduces spasticity. Intrathecal baclofen can reduce severe spasms. Seizures can be managed with medications. Bowel and bladder dysfunction is common, so that's managed whether they have incontinence or retention. The airway may need to be protected if they have speech and swallowing issues. Strabismus is common, which affects vision, and so that's corrected as soon as it's possible. So surgery doesn't fix the cerebral palsy, but they may need surgery to help maximize their abilities. Another goal is to educate the child to the limit or to the extent of their abilities and needs. We want to give them as much education as they can, as they need. Promote socialization, emotional support. The needs are often complex and they're very individualized. So we may be providing a lot of individual support for families. For prognosis, 30 to 50% of kids with cerebral palsy have cognitive impairment. A higher percentage have some mild cognitive and learning difficulties. Growth is often affected. More mobility is affected. And if they're not walking by 7 years of age, it's less likely they'll be able to walk. Survival varies. Usually mortality is because of the specific disabilities caused by this. Severe mobility impairment and feeding problems are associated with a higher risk of dying from respiratory infections. Okay, next we're going to talk about sensory impairments.